sports are a lot of fun, but there are some dangers as well with sports.
Very true. And so while many parents may be hitting the field cheering on their athletes, there are injuries to look out for. And here to talk about some of the most common injuries and possible treatments is orthopedic surgeon Dr. Christopher Variati, who is trained in sports medicine, and he's with the Adventist Health Physicians Network. Thanks so much for being here, doctor.
Glad to be here. Thanks for having me.
So first of all, what is the number one thing parents should know? Because you want to get your kids involved in sports, don't you?
Absolutely. So I think the number one thing to teach our kids and for parents to know is kind of just let kids be kids.
Yeah.
You know, let them go out and play multiple sports. And the thing that's, gets kids into trouble when they're younger is just, letting them play one sport, specializing in one sport, and not, letting them have some time off to rest and recover from the season.
Well, I know that you've treated injuries for players in Major League Baseball, including the Atlanta Braves, and even professional football teams. So what are the most common injuries that you've seen, particularly in football?
Football, so I mean, you see a wide variety of injuries in football just due to the nature. It's a contact sport. So we see injuries, shoulder, elbow, we see knee injuries, and we see ankle injuries. So I'd say the most common ones we see are ankle injuries. Usually don't require surgery. Knee injuries are common as well, meniscal tears, ACL tears, and you can have more traumatic injuries such as broken leg, which we see it seems to be more common now with change in playing surfaces and whatnot.
Okay, so what's going on with professional sports? They're trying to make the game safer. There's some recent rule changes.
Yeah, absolutely. So there's new changes with the game with college football as well as the NFL. One of the big changes is what they call targeting. So when a player leaves with their head and they contact another player with their helmet, it's at least a personal foul, and they can be ejected from the game and actually miss the next game too.
So helmets aren't foolproof, are they?
Exactly.
Yeah, that's for sure. Okay, so what kind of advice can you offer all of us out there as parents in order to kind of prevent these injuries? I mean, aside from going out to the field and dragging them out, because we can't do that, right? But what can we do?
Yeah, so I mean, as far as parents go, I said let kids be kids. You got to let them, play what they like to do, and not just have them focus on one sport. Give them time to recover. Teaching them proper pitching mechanics, throwing mechanics are key to avoid injury in any sport. So that's...
What do you mean by showcases? Be careful with showcases.
Yeah, so showcases is basically when a young athlete is taken to a camp or a pitching seminar where there's scouts there, and the scouts, want to see how the athlete's throwing, so the child will kind of overthrow and can expose themselves to injuries that way.
So let's talk a little bit about your personal history, doctor. You yourself are an athlete, and has that contributed to you being a better surgeon?
Yeah, I think that being a former athlete, you kind of can think like an athlete and be able to relate to the athlete better when it comes to an injury. And as far as treating a player for an injury, you can kind of be positive and be able to focus on exactly what you're dealing with as far as the injury goes.
When, as a parent, do you think we should realize it's time to take our child in to an orthopedic surgeon like yourself? Because a lot of times they hurt themselves and they go around and they're in pain and you tell them to ice it, ice it, but you don't do anything else about it. At what point should we be taking them to the doctor and take it seriously?
Yeah, so I mean, I think that after you've given it a fair chance with common things, most common things can be treated with common regimen we know as RICE, rest, ice, compression, elevation.
Ooh, I like that,
I
RICE.
like that. Wait,
RICE, R-I-C-E.
Yeah.
Oh, I thought you meant like giving rice. What do we have to say?
Okay, doctor, repeat that. RICE. This is what parents should know.
Ice, compression, elevation.
Okay.
RICE.
Okay, good.
So those are common things. Usually that can treat 90% of common sports injuries, overuse injuries. But if it gets to the point where that's not as successful or it's not working any longer, I'd say might be time to come and take a look.
So don't eat rice, just do rice.
Okay, well, I thought maybe you're supposed to soak it in. I don't know. That's how little I know about sports.
These are all great tips, doctor. Where can people get a hold of you?
So my office is located at the Hanford Medical Pavilion in Hanford, right next to the hospital. So I'm accepting new patients.
But you don't just treat children in sports.
No, no.
Yeah. You do a lot of other
Absolutely.
things. Okay. All right. So don't forget that you can get hold of him there at the Hanford Medical Pavilion. The number 537-0330. You can also go to AdventistHealth.org for a lot more information. And before we leave, I've got to ask you because, and this is going to be a tough question. Are you ready for this one, Doctor? At what age do you think it's best to start a child off in football? That's a big sport right now.
Yeah, I mean, I'd say 7th and 8th grade is probably a good year.
Okay.
I mean, there are a lot of youth leagues that start earlier than that. But,
Really early.
yeah.
I'm talking 5, 6 years old. Is
Right.
that too early, you think?
I think it could be a little bit too early for a contact sport like that. Yeah.
Oh, okay. Okay.
Good to know.
Yeah. It is.
Well, awesome advice, Doctor, and thank you so much for coming on and helping
Absolutely.
educate everybody. We appreciate
Thanks
it.
for having me.
Thanks, Doctor.
Definitely.